The next epidemic could originate on the computer screen of a terrorist intent on using genetic engineering to create a synthetic version of the smallpox virus. Bill Gates. SIGA Technologies, which likens its products to human bioarmor, features a quote from Bill Gates at the top of its About page. The quote reads, "The next epidemic could originate on the computer screen of a terrorist intent on using genetic engineering to create a synthetic version of the smallpox virus." The quote is from Bill Gates' speech to the 2017 Munich Security Conference, where he used the threat specifically of smallpox to argue that health security and international security be merged. Notably, last March, the Munich Security Conference hosted a simulation of a global pandemic caused by a genetically engineered monkeypox virus. Strengthening global systems to prevent and respond to high-consequence biological threats. Results from the 2021 tabletop exercise conducted in partnership with the Munich Security Conference. Summary: in March 2021, NTI partnered with the Munich Security Conference to conduct a tabletop exercise on reducing high-consequence biological threats. The exercise examined gaps in national and international biosecurity and pandemic preparedness architectures, exploring opportunities to improve prevention and response capabilities for high-consequence biological events. This report summarizes the exercise scenario, key findings from the discussion, and actionable recommendations for the international community. Executive Summary. In March 2021, the Nuclear Threat Initiative, NTI, partnered with the Munich Security Conference, MSC, to conduct a tabletop exercise on reducing high-consequence biological threats. Conducted virtually, the exercise examined gaps in national and international biosecurity and pandemic preparedness architectures and explored opportunities to improve capabilities to prevent and respond to high-consequence biological events. Participants included 19 senior leaders and experts from across Africa, the Americas, Asia, and Europe with decades of combined experience in public health, biotechnology industry, international security, and philanthropy. The exercise scenario portrayed a deadly, global pandemic involving an unusual strain of monkeypox virus that emerged in the fictional nation of Britannia and spread globally over 18 months. Ultimately, the exercise scenario revealed that the initial outbreak was caused by a terrorist attack using a pathogen engineered in a laboratory with inadequate biosafety and biosecurity provisions and weak oversight. By the end of the exercise, the fictional pandemic resulted in more than 3 billion cases and 270 million fatalities worldwide. Discussion among exercise participants led to the following key findings: weak global detection, assessment, and warning of pandemic risks. The international community needs a more robust, transparent detection, evaluation, and early warning system that can rapidly communicate actionable information about pandemic risks. Gaps in national-level preparedness. National governments should improve preparedness by developing national-level pandemic response plans built upon a coherent system of triggers that prompt anticipatory action, despite uncertainty and near-term costs, in other words, on a no-regrets basis. Gaps in biological research governance. The international system for governing dual-use biological research is neither prepared to meet today's security requirements, nor is it ready for significantly expanded challenges in the future. There are risk reduction needs throughout the bioscience research and development lifecycle. Insufficient financing of international preparedness for pandemics. Many countries around the world lack financing to make essential national investments in pandemic preparedness. To address these findings, the authors developed the following recommendations. 1. Bolster international systems for pandemic risk assessment, warning, and investigating outbreak origins. The WHO should establish a graded, transparent, international public health alert system. The United Nations, UN, system should establish a new mechanism for investigating high-consequence biological events of unknown origin, which we refer to as a joint assessment mechanism. More about the joint assessment mechanism is found on page 22. NTI Paper 7 www.nti.org www.nti.org Strengthening Global Systems to Prevent and Respond to High-Consequence Biological Threats. To develop and institute national-level triggers for early, proactive pandemic response. National governments must adopt a no-regrets approach to pandemic response, taking anticipatory action, as opposed to reacting to mounting case counts and fatalities, which are lagging indicators. To facilitate anticipatory action on a no-regrets basis, national governments should develop national-level plans that define and incorporate triggers for responding to high-consequence biological events. More about triggers is found on page 17. 3. Establish an international entity dedicated to reducing emerging biological risks associated with rapid technology advances. The international community should establish an entity dedicated to reducing the risk of catastrophic events due to accidents or deliberate abuse of bioscience and biotechnology. To meaningfully reduce risk, the entity should support interventions throughout the bioscience and biotechnology research and development lifecycle, from funding, through execution, and on to publication or commercialization. 4. Develop a catalytic global health security fund to accelerate pandemic preparedness capacity building in countries around the world. National leaders, development banks, philanthropic donors, and the private sector should establish and resource a new financing mechanism to bolster global health security and pandemic preparedness. The design and operations of the fund should be catalytic, incentivizing national governments to invest in their own preparedness over the long term. 5. Establish a robust international process to tackle the challenge of supply chain resilience. The UN Secretary-General should convene a high-level panel to develop recommendations for critical measures to bolster global supply chain resilience for medical and public health supplies. This report is organized into 3 parts. The first is a description of the exercise design and scenario. The second is a summary of the exercise discussions and related findings. And the third is a set of recommendations developed by the authors to address the identified gaps and requirements. NTI developed these recommendations after the event concluded. Participants were not involved in their development and have not been asked to endorse them. The appendices provide a list of the experts who supported the exercise development process. Appendix A, as well as technical details about the epidemiological model, Appendix B, used to inform this fictional monkeypox pandemic scenario. NTI Paper 8 www.nti.org www.nti.org Strengthening Global Systems to Prevent and Respond to High-Consequence Biological Threats. About the exercise. In March 2021, NTI conducted a tabletop exercise on reducing high-consequence biological threats, the third in a series of annual collaborations between NTI and the Munich Security Conference. The exercise examined gaps in national and international biosecurity and pandemic preparedness architectures and explored opportunities to improve capabilities to prevent and respond to high-consequence biological events. The exercise included 19 senior leaders and experts from across Africa, the Americas, Asia, and Europe with decades of combined experience in public health, biotechnology industry, international security, and philanthropy. See the box on page 9 for the list of exercise participants. Exercise scenario. Developed in consultation with technical and policy experts, the exercise scenario portrayed a deadly, global pandemic involving an unusual strain of monkeypox virus that first emerges in the fictional country of Brunei and eventually spreads globally. Later in the exercise, the scenario reveals that the initial outbreak was caused by a terrorist attack using a pathogen engineered in a laboratory with inadequate biosafety and biosecurity provisions and weak oversight. The exercise scenario concludes with more than 3 billion cases and 270 million fatalities globally. As part of the scenario development process, NTI conducted a virtual consultation with experts in December 2020. See Appendix A for the list of participating experts. The exercise was designed for participants to discuss requirements for international architectures related to science-based, early assessment of emerging pandemic risks and timely international warning and alerts for potential pandemics. Explore conditions that should trigger national pandemic response actions and discuss strategies and challenges for scaling public health interventions. Consider options to reduce biotechnology risks and strengthen oversight of dual-use bioscience research. Explore opportunities to strengthen international financing mechanisms to bolster global health security preparedness. The fictional exercise scenario unfolded in a series of short news videos that participants reacted to. NTI Paper 9 www.nti.org www.nt. The discussion was organized into 3 sequential moves corresponding with scenario developments, followed by a roundtable discussion of broader biosecurity and pandemic preparedness issues. The step-by-step approach to revealing scenario developments reflected the limitations of information available to real-world decision-makers, as well as the resulting uncertainty associated with a pandemic of unknown origin. See Move 1, occurring on June 5, 2022, in scenario time, starts with an unusual outbreak of monkeypox in Brunei, population 250 million, with reports of 1,421 cases and 4 fatalities. There is no immediate evidence of international spread, but the outbreak takes place during a national holiday with extensive domestic and international travel by Bruneians. Because monkeypox is not naturally found in Brunei, local and international experts consider this outbreak to be unusual. The Bruneian government welcomes international outbreak investigations and requests medical support from the WHO. Genome sequencing of monkeypox patient samples reveals that the strain in Brunei contains mutations that make it resistant to existing vaccines. The discussion that followed considered how the international system is postured to analyze initial indicators of pandemic risk and to communicate appropriate warnings. Move 2, January 10, 2023, occurs 6 months later, at which point the virus has spread to 83 countries with 70 million reported cases, causing more than 1.3 million fatalities. With no known effective therapies or vaccines, countries have had to rely principally on non-pharmaceutical interventions, NPIs, to mitigate the impacts of the pandemic. Highlighting significantly different national outcomes in managing the pandemic, some governments, including the fictional Republic of Drama, promptly adopted aggressive measures to slow virus transmission by shutting down mass gatherings, imposing social distancing measures, and implementing mask mandates. These countries have also established large-scale testing and contact tracing operations and scaled up their healthcare systems to support anticipated growing case numbers. By contrast, the scenario depicts another group of countries, including fictional Cardis, that have prioritized keeping their economies open, undertaking little to no NPIs, and downplaying the virus and its potential impacts. These countries have experienced much worse outcomes in terms of illness and mortality, Figure 2, than those that responded early and energetically. As Figure 3 shows, Dranma experienced far fewer cases and fatalities than Cardis. Participant discussion in Move 2 focused on exploring the conditions that should trigger national pandemic response actions and discussing strategies and challenges for scaling public health interventions. NTI Paper 12 www.nti.org www.nti.org Strengthening Global Systems to Prevent and Respond to High-Consequence Biological Threats. Move 3, May 10, 2023, occurred 12 months after the initial outbreak, with more than 480 million cases and 27 million fatalities globally. Figure 4. At this stage, participants learned that the pandemic was caused by a regional bioterror attack that far exceeded the perpetrator's goals. Specifically, Brinian intelligence reveals that the engineered monkeypox virus was developed illicitly at the fictional country of Arnica's leading institute for virology. Arnica, population 75 million, has a history of conflict with neighboring Brinia, see map and Figure 5. An independent Arnican terrorist group, the SPA, had worked with sympathetic laboratory scientists to engineer a highly contagious, deadly pathogen and disperse it at crowded train stations in Brinia during the national holiday, when much of the population was traveling domestically and internationally. The SPA had exploited the Arnican government's weak oversight of its bioscience research laboratories. SPA sympathizers working in Arnica's leading virology institute used publicly available scientific publications to guide their work to modify the monkeypox virus to make it more transmissible and resistant to currently available vaccines. The discussion in Move 3 focused on governance of dual-use bioscience research as well as current weaknesses in biosafety and biosecurity systems that exacerbate biological risks. The final phase of the exercise was a roundtable discussion that considered disparities in public health preparedness around the globe and the resulting need for more effective financing mechanisms to accelerate pandemic preparedness capacity building. Recognizing that pandemic preparedness requires costly investments that lower and lower middle income countries cannot afford to make, participants were asked to discuss strategies to catalyze these investments in sustainable ways. Brinia. Summary of exercise discussion and findings. The discussions throughout the tabletop exercise generated a wide range of valuable insights and key findings. Most significantly, exercise participants agreed that, notwithstanding improvements following the global response to COVID-19, the international system of pandemic detection, analysis, warning, and response is woefully inadequate to address current and anticipated future challenges. Exercise participants agreed that gaps in the international biosecurity and pandemic preparedness architecture are extensive and fundamental, undermining the ability of the international community to mount effective responses to future biological events, and they noted that robust preparedness will require fundamental transformation across a number of fronts. Given the inherent latency in acquisition of definitive data on pandemic threats, example, geographic distribution, transmission rates, and lethality, and the very serious consequences of delay in pandemic response, participants observed that the international system and national governments must be transformed to emphasize predetermined no-regrets anticipatory actions. Such a system requires significant improvements in the international community's ability to detect, assess, and warn about pandemic threats as well as to develop proactive, national level response plans and decision-making bodies. They agreed that the international community also must bolster its system of governance for dual-use life science research, and they concluded that governments globally are severely underinvesting in pandemic preparedness, especially in low and lower middle-income countries. These consensus findings frame the more detailed conclusions discussed below.